James Green. I am a distributor owner for Alphatech in the southern U.S. We're here today to do the first prone transpsoas approach surgery in Mississippi. One of the first surgeries in the United States with this technique.
I was going to the spa every day. I was walking 5 miles every other day, and then I don't know what happened. I don't know what I really did to slip the disc, but it happened. One time I did a deep cleaning in a room, and I was on a cane for the next 2 days. I said, my goodness. Very limited to that, and walking. I couldn't walk far no more. I love to walk. And standing, stepping, like shopping, go to one spot. Couldn't do that anymore.
Today we're going to do what's called a lateral lumbar interbody fusion. That is a procedure where we are able to place a large graft in the anterior vertebral column, which is between the vertebra, and that generally allows good distraction where the holes are that the nerves pass through, so it can relieve a lot of pressure on the nerve roots. Today we're doing it a slightly different way than what has been taught traditionally, and it's with the patient in an actual more traditional position where the patient is laying on their stomach. In the older way, the patient is generally laying on their side, which introduces variability with the staff knowing how to do it safely. And then also many patients need a posterior portion of the procedure, and with that the patient is required to transition to a second table, which again adds complexity and potentially safety concerns in the case. The way we're doing it today eliminates those potential complexities, and I think improves on the overall safety. I also think it can help with surgical timing and time under anesthesia, which again translates into a quicker recovery, less medication that has to be administered to the patient, and overall a better outcome.
I had it Wednesday, August 5th, and I went home Saturday. This one was a lot easier than the first one. It took me a while to get over that one. Of course, they went through the back. But this one, it amazed me how quick I was getting up and moving and doing things.
The surgery stabilizes the spine through a minimally invasive approach. The big difference with this is surgery for years. We've done lateral fusion for years. Previous to the patient, we put in a lateral decubitus position, taped to the bed, and in the procedure, the surgeon would put the cage in, then we'd have to untape, flip the patient prone, and put screws in to stabilize. With this technique, we're able to put the patient prone from the beginning, do everything from one position. So we're putting the patient in a more normal sagittal position that allows us to create more normal lordosis for the patient and save a lot of OR time.
I was just thankful I was referred to Dr. Cox. He said he did just a wonderful job, and I'm happy about it.
I've worked with Dr. Cox since he was at TBI at his fellowship there. Alphatech, the company that I represent, is a small, fast-growing company in spine, and it's key to us to partner with young surgeons who are going to innovate the future. Dr. Cox was at a fellowship, Texas Back Institute, a very prestigious fellowship, and he is the kind of surgeon that we're trying to partner with right now to help innovate and design things for the future. He'll be in this field for many years to come. And those are the guys that, as a company, we want to partner with and help build the future with. I will tell you that I live in Houston, and at first, I love Mississippi in general, but this is a great facility. They take care of Dr. Cox. You see a lot of hospitals where that's not necessarily the case, and this absolutely is a place that I know he's happy working at, and we're happy to be here with him.